So I guess I'm bringing up the rear of the Australian contingent of presenters in this session. I'm going to jump right in, and I'm very proud today to be presenting on a peer-implemented model of care for hepatitis C antibody testing called Empower. This is funded by the Kirby Institute as a sub-study of the National Program for Hepatitis C testing. I'd like to begin today by acknowledging the traditional custodians on the land I'm privileged to work on in the Empower study, who are the Gadigal and Darug people. I'd also like to take a moment to acknowledge the peer workers who I work with at Hepatitis New South Wales and the community that we serve, without whom this would not be possible. My disclosures are also on the screen for you. So Empower exists because despite significant improvements that we know of, to scale up of hepatitis C testing and treatment, key populations are still facing unique barriers to accessing care. Empower is a peer-implemented model of point-of-care antibody testing with immediate reflex point-of-care RNA testing. Peer workers with lived experience of hepatitis C and treatment are responsible for the enrolment process, which allows for connection and fostering trust within our key communities. Enrolment involves informed consent, completion of a question and answer style survey, and a conversation with a peer. Participants with no previous history of Hep C are offered immediate rapid antibody testing using InstiTests, and these are performed by a peer worker. And participants with a self-reported history of Hep C or Hep C treatment are offered immediate RNA testing via a gene expert machine. This is performed by local healthcare teams who we partner with at every single one of our outreach events. And this is to ensure that wraparound testing care is available, and also Hep C treatment workup can be started immediately for folk who are found positive. So some success, I've got a minute to race through this. Over the last 14 months, we've held 28 events listed at sites on the screen: homelessness services, accommodation services, and residential rehab. We have enrolled a total of 451 unique participants, 380 of which have received antibody testing with a peer worker. 173 tests, RNA tests, have been required, and 120 of which after disclosure of previous Hep C, and 32 after reactive antibody results. So it's really excellent to see that the availability of the antibody tests are saving financial and human resourcing and allowing for much more focused use of the gene expert machines. There have been 14 people with Hep C. 5 have initiated treatment, 4 are within a 12-week follow-up window to see where they're at with their treatment journey, 4 have been lost to follow-up, and 1 was actually found to be on treatment already. And literally with my last 5 seconds, I just want to acknowledge the collaborators on the screen and provide some contacts for questions in the future if anyone has any.
Time for a quick question and short answer. One question there.
Hi, I'm Ryan Davis, point-of-care testing practitioner for Public Health Wales. Just a quick question. I can notice your prevalence of antibody positivities is quite high, is certainly more than what we find when we're doing tests across Wales. Is there a different targeting procedure, or is the prevalence just a lot higher in Australia?
I think that's a fantastic question, which probably could be answered by the broader national program data. Anecdotally, I can say that we have a lot of people with previous history of incarceration and also quite a bit of injecting drug use in all of the services that we've visited in this sub-study.
Okay, thank you very much.